Codathon, where we're going to focus on CPT modifiers. This is a very short session. What's going to happen is that just like last week, I'm going to give you a scenario, and then you will have to guess what the modifier is. This session is being recorded, and I will provide the recording link to all of the instructors. If you are in my class, I will post the link in my class somewhere. All right, so let's go ahead and get started. First scenario, you have a 14-year-old male that presents as an outpatient to the laboratory for aerobic and anaerobic cultures of 2 sites of a single vertebral or vertical wound to the anterior left foreleg incurred, which is a result of a scooter mishap. The laboratory technologist obtains independent specimens, one from the proximal wound site, the other from the distal site. For aerobic culture of drainage material for testing, using the appropriate type of aerobic culturettes. The laboratory technologist also obtains independent specimens using anaerobic culturettes, one from the proximal wound and one from the distal wound site. For an anaerobic culture, which modifier would be assigned for the laboratory specimens? And specifically for this one, it would be the second, or the laboratory test after the first one, I should say. I'm tongue-tied this evening. So 91 is correct. 91 is correct. Next up, a surgeon assists for a small portion of a rotator cuff tear and helps to position the arm and perform a partial suture of the cuff for a total rotator cuff tear. What modifier is for the second assistant surgeon? So the correct modifier for this one would be 81, and that's because this is for the second assistant, not the assistant surgeon, but the second assistant surgeon. So that would be modifier 81. It's all about the wording. Next up, Dr. Jones, an internist, performs an examination of a non-Medicare patient, and as part of the exam, orders complete blood count. He does not perform in-office laboratory testing and has an arrangement with the laboratory to bill him for the testing procedure, and in turn, he bills the patient. And then the physician's staff performs the venipuncture. So what would the modifier be for the laboratory test that he's going to send out to the lab? And modifier 90 is correct. Next up, so modifier 90 is correct. Next up, the surgeon performed a carpal tunnel procedure on the right and the left wrist during the same operative session for a 40-year-old patient with carpal tunnel syndrome. So what would the modifier be for this procedure? And it would be modifier 50. That's correct. A pressure sore of the right ankle and hip were debrided in the morning, but due to the patient's condition, the selective debridement of the sacral pressure ulcer was performed at a separate session in the afternoon on the same date. So you want to tell the insurance company that these two procedures were separate and significant. What modifier would that be? Okay, 59 is correct. Okay, next up. The patient was taken back to the operating room through an incision in the extremity over the affected area. The physician isolates the vessels and explores it for post-op complications, such as hemorrhage, thrombosis, or infection. The physician found the hemorrhage, dissected the adjacent critical suture or structures as necessary to access the vessel. The complication was identified and corrected. The hemorrhage is controlled by suture repair of the artery. The physician sutured the skin incision with a layered closure, and the patient returned to the operating room in good condition. So the patient was taken back to the operating room. So you have to ask yourself, is this related to the original procedure, or is this unrelated to the original procedure? All right, so the modifier would be 78 because the key here was taken back to the operating room. And if you notice, he's exploring it for post-operative complications. So this would be 78. Next up, the patient was seen and evaluated by the general surgeon, who was 100 miles away from the nearest hospital. The surgeon performed the surgery. The patient returned home and follow-up care was rendered by the primary care physician. But the question is, which modifier would be assigned by the general surgeon? "54" is correct. Next up, 44-year-old woman, dyspneic, at rest for severe chronic obstructive lung disease and required home oxygen. The physician decided that a lung transplant was necessary. At thoracotomy, the left lung is removed by dividing the left main stem bronchus at the level of the left upper lobe. The two pulmonary veins and the single pulmonary artery are divided distally. An autograft lung is inserted, and the recipient left mainstream bronchus and pulmonary artery are resected to accommodate the transplant. The recipient pulmonary veins are opened into the left atrium. An end-to-end anastomosis of the recipient's receptive structures, pulmonary artery, mainstem bronchus, and the left atrial cuffs, is made to similar donor structures. Two chest tubes are inserted, and the bronchoscopy is performed in the operating room. So the question is, what happened today? It was a transplant. So which modifier would be used for the people who are doing the transplant? And you notice I said people because it's more than one. "66" for a surgical team. That is correct. All right, a middle-aged patient presents with progressive painful restriction of the Hallux metatarsal phalangeal joint. The patient has been treated conservatively without success. The patient is treated surgically with a distal first metatarsal chelectomy. This includes removal of the bone at the distal first metatarsal proximal phalanx, debridement of the metatarsal phalangeal joint, and capsula. During the same operative session, the surgeon corrects a hammer toe on the third toe. So you got multiple procedures all in the same area. Which modifier would that be? "51" is correct. Next up, A 40-year-old male patient who sustained a work-related back injury without subsequent surgical repair reconstruction, who has participated in an acute therapy program, and who continues to exhibit pain, weakness, fatigue, stiffness, and possible psychosocial limitations. Return to work potential is undetermined. The workers' compensation carrier requests an evaluation of the patient's current condition and prognosis from an orthopedic surgeon for a second opinion. And then this physician performs a comprehensive history and exam, and the medical decision making is moderate. So the question is, what is this orthopedic surgeon who is rendering the second opinion going to use? And he's going to use a 32. You are correct, because he was mandated, this service was mandated. And basically, insurance companies, they don't want to pay for surgery. So if they can have the patient have a conservative type of service done, such as therapy, they'll have them do that first. And then if it doesn't work, then they'll say, okay, we'll pay for surgery. All right, next up. The patient had a discectomy with fusion of L4 and 5 vertebrae 70 days ago. Anytime you see some numbers, think post-op. The patient tripped over a toy at home, fell and fractured the right radial shaft. The orthopedic surgeon who performed the first procedure is contacted. The surgeon performs, so that same surgeon who did the first surgery, performs a closed manipulation of the radial shaft and applies a cast. The second procedure is unrelated to the first procedure. And I'll just give you a hint. It's not a 24. 24 goes on an E&M code. All right, so 79 is correct. 79 is correct. We're returning to the operating room during the post-operative period, but the procedure is unrelated to the first. Next up, an established Medicare patient visited her internist in follow-up for hypertension and diabetes. The patient also complains of left knee pain, which started to bother her while working in the garden. The physician performs a problem-focused history and exam and evaluates the patient's hypertension and determines the blood pressure is higher than it should be and adjusts the medications. The patient's blood sugar is doing well and the diabetes is well controlled with the insulin regimen. During the encounter, the physician also evaluates the knee and determines that the patient would benefit from arthrocentesis. The physician gives the patient an injection and schedules a follow-up for 1 month. Which modifier would be assigned to the E&M encounter? So essentially, you're going to have a code for your E&M, but you also are going to have a code for the arthrocentesis. So you want to let the insurance company know that you have a separate, significant, identifiable E&M on the same day, which is a modifier 25. Hey, who said they were nervous in the beginning? All right, next up, an assistant surgeon is frequently used in arthrodesis surgery. The assistant will help hold the vertebrae in place and assist in harvesting and placing the bone graft. Which modifier would be assigned? 80 is correct. A lung hernia through the chest wall needs immediate repair in a teaching hospital setting. The residents on call are assisting in another procedure. A second thoracic surgeon assists the primary surgeon. Which modifier would be assigned? The resident is on call and assisting in another procedure. So yes, it would be a modifier 82. All right, here's a long one. 65-year-old diabetic man who is pacemaker dependent is noted to have episodic failure to pace. Non-invasive telemetry has been performed and low impedance detected. The patient is taken to the catheterization lab after receiving mild sedation. A temporary transvenous pacemaker is inserted through the contralateral internal jugular vein and its pacing parameters are tested. The original pacer site is prepped, and under local anesthesia, the pacer and the lead are carefully dissected free of scar tissue. The lead is disconnected from the pacer and visually inspected. Its electrical integrity is evaluated with a pacing system analyzer. A focal defect in the external insulation is noted and repaired using a piece of tubular insulation, adhesion, and suture material. The electrical integrity is confirmed using the pacing system analyzer. The temporary lead is withdrawn and the pacemaker and repaired lead are carefully reinserted into the pocket and they close it up. The entire procedure is performed with automated cuff blood pressure, pulse ox, and ECG monitoring. The patient returned 4 weeks later for a routine follow-up with complaints of lethargy, weakness. Blood sugars are low or high, ranging from 280 to 350. The physician performed an expanded problem-focused exam and determined that the patient's insulin needed to be adjusted in addition to counseling on diet and exercises. Routine follow-up for the pacemaker was also performed. So when the patient is in the postoperative period, we actually cannot bill out a service. The only code we can use is a 99024. That code says postoperative service. But this patient had a problem that required an evaluation and management service that was unrelated to the procedure that he was in the postoperative period for. So in order to ensure that the insurance company will pay for this service, we have to use a modifier 24, so you guys are correct. A patient in a rural area sees her general surgeon regarding abdominal pain. The patient has a prior history of abdominal surgery and x-rays and laboratory testing is performed. The physician assesses the patient and determines that the patient needs surgery. Since the physician does not perform this surgery, the patient is sent to the gastroenterologist. The general surgeon contacts a gastroenterologist who provides all the supporting data and testing and surgery is scheduled. The general surgeon sends a letter to the surgeon requesting he provide only the surgical portion of the surgery and he will provide the postoperative care. So which modifier is assigned for the general surgeon? So one thing that you need to notice here, since the physician does not perform this surgery, he sends the patient to a gastroenterologist. The general surgeon contacts the gastroenterologist, provides all the supporting data and the testing, and the surgery is scheduled. The general surgeon sends a letter to the surgeon requesting that he provide the surgery portion only, and he will provide the postoperative care. So which modifier is assigned for the general surgeon? So I'll give you a second to look at this again. The general surgeon is in the beginning. And what did the general surgeon say that he was going to do? What did the general surgeon say that he was going to do? Look at the last sentence right before the question. So it's two surgeons here. You guys notice that? There's two surgeons. He will provide the postoperative care. So the first surgeon, who was called the general surgeon, will provide the postoperative care. So which modifier is that? So one thing that's very important, when you have these long scenarios, it's very easy to get caught up in the scenario and lost. And you have to keep asking yourself, what is the question? So remember that not all surgeons, or let me back up. Not all specialist physicians perform surgery. So a physician could be a cardiologist but doesn't perform cardiovascular surgery. So oftentimes they will find someone that can do the surgery. They'll do the surgery only, and then that person who is that patient's doctor, they'll get paid for whatever portion that they do. Does that make sense? Okay. Next up, 67-year-old male patient presents with COPD and CAD status post MI, has a 5.8 centimeter aortic aneurysm. Imaging studies indicate that the aneurysm is infrarenal with an adequate neck to allow for successful deployment of an endovascular prosthesis. There is also an adequate normal aorta below the aneurysm to allow the use of a tube graft. The iliac anatomy should accommodate passage of the device. The procedure was performed by two surgeons that were acting as co-surgeons. So yes, that would be 62. And each surgeon would report the same code, and both of them would use a 62. So they would report the same code, and both would use a 62. Next up, primary care physician performs a chest x-ray in the physician's office and observes a suspicious mass. He sends the patient to the pulmonologist, who on the same day repeats the chest x-ray. The pulmonologist also provides the total procedure for the x-ray, the technical and the professional. The rationale for repeating the chest x-ray is that the film does not give the pulmonologist a good picture, and he wants to repeat the x-ray to confirm the diagnosis. So which modifier would be assigned by the radiologist? And FYI, 91 is for laboratory tests. Here you have two chest x-rays, and 77 is correct. So 91 is for laboratory tests, not like x-rays, etc. All right. Next up, a patient presented to the OR for a diagnostic arthroscopy of the knee. The physician inserted the arthroscope and the patient suddenly went into respiratory distress. The arthroscope was withdrawn and the procedure was terminated. Which modifier would be assigned? 53 is correct. 53 is correct. 67-year-old female presents to the surgeon with a prior history of abdominal surgery and a strictured segment of the small bowel evident on small bowel follow-through radiographs. Prior to surgery, the surgeon reviews the laboratory and X-ray imaging filming studies to plan the operative approach. He discusses the procedure with the patient and obtains informed consent. At operation, dissection of the bowel is performed. The strictured segment is mobilized and resected, and the bowel continuity is reestablished. The patient is released from the hospital the next morning in good condition, and transfer of care occurs back to the general surgeon in her hometown. Which modifier would be used by the general surgeon? 55 is correct. 55 is correct. All right, next up, the patient consents to undergo surgery to repair a perforated ulcer. The operation is performed later that day. The procedure planned based on findings is suture of the small intestine for perforated ulcer, diverticulum, wound, injury, or rupture, single perforation. Which modifier is assigned for the patient's decision to undergo surgery? Okay, 57 is correct. Next up, a 5-year-old boy with an implanted programmable CSF valve and shunt system is referred by a pediatrician for recent onset of constant complaints of a headache. His history includes implantation of the shunt 3 years prior for hydrocephalus. After reviewing the patient's chart and previous films and evaluating the patient in the office, the surgeon decides to decrease the shunt pressure. The surgeon orders a radiograph to determine the current setting of the shunt valve. After reviewing the results of the radiograph, the physician reprograms the shunt from 120 mm to 80. This is done in the radiology department. After confirming the pressure setting, the patient is released from the radiology department. The surgeon dictates a written interpretation and report and a follow-up phone call to the boy's family several days later that finds that the headache has not occurred since reprogramming. The written report is sent to the referring pediatrician. Which modifier would be assigned by the surgeon? Which modifier would be assigned by the hospital? So here you have a professional component and a technical component. So which modifier would be for the surgeon and which would be for the hospital? So 26 is correct for the professional component. The modifier for the hospital is modifier TC, which is technical component. Okay, next up. A surgeon performs a radical mastectomy on a 56-year-old female patient. The patient indicated that she preferred a permanent prosthesis after the surgical wound healed, which the doctor agreed to perform. The surgeon took the patient back to the operating room and during the postoperative global period and inserted a permanent prosthesis. Which modifier would be assigned to the prosthesis code? So we're returning to the operating room during the postoperative period. And 58 is correct. 58 is correct. Next up, 28-year-old woman, established patient, presents to the office for a health evaluation and physical exam. Her interval past medical history is reviewed. A complete review of systems is documented. The patient also has a detailed exam. They refuse the pelvic exam. They also have a pap smear and a breast exam. Counseling is performed regarding diet, exercise, and substance abuse, sexual activity, and dental health. Risk factors are identified and interventions are discussed. Medically appropriate laboratory tests are ordered. Which modifier would be assigned to the preventive E&M service? $33? Okay. All right. The surgeon initiates a regional bear block. The physician monitors the patient and the block while performing a flexor tendon repair of the forearm. Which modifier would be used? Correct. Anesthesia by a surgeon. That is correct. And the way that you should know this, in the surgery section, in the guidelines, they tell you what's included in the surgical package. And there's only certain types of anesthesia that's included in the surgical package. So if you don't know what those are, go back and take a look at those particular items. But this is actually anesthesia by a surgeon. Next up, a physician performed a laminotomy with decompression of the nerve root with a partial fasciectomy, foraminotomy, and excision of a herniated disc. During the surgery, the physician encountered excessive bleeding, which was difficult to control. This required an additional 60 minutes of time to complete the surgery, which modifier is assigned. Okay, modifier 22 is correct. So modifier TC is actually a HCPCS modifier. You guys do not have a HCPCS manual. I'm going to upload for you a copy of the 2016 HCPCS codes and HCPCS modifiers for your records. And it is in the textbook. So go ahead and download this file here, which is sitting right above everybody's names, and then you'll have a list of the codes, the HCPCS codes and the modifiers. All right, next up, a pulmonologist inserts a chest tube in the ER. A chest x-ray is performed prior to the placement of the chest tube and after placement to verify position of the chest tube at the same operative session by the same provider. Which modifier would be used for the second x-ray? And it's by the same person. Starts with a 7. 76 is correct. All right, next up. A 3-week-old, not 15-gram premature infant develops abdominal distension, intolerance of feeding, and clinical signs of sepsis. I'm going to stop there because the first sentence tells it all. Which modifier is this? 63 is correct. And the last one for tonight. 6-year-old boy presents to the ER with a fish hook in his finger. Typically, the removal of the fish hook would be performed under local anesthesia. The boy is hysterical, and the ED physician is unable to hold the boy's hand still. General anesthesia is required to remove the fish hook. What modifier would be assigned? Okay, you guys are correct. You did an awesome job on tonight. Really takes time to practice the modifiers. The more you do them, the easier it becomes. So, do you need me to do another one of these next Friday? Okay. So I will do another one next Friday at the same time. You will get the link from your instructors. I don't know where they're posting it, but you'll get the link from your instructors. I have to create a new link every week.